It is amazing, actually. I mean, those are the types of strokes that can be severely disabling, the most severe types of strokes. And being able to have the technology now to go up to the blood vessels in the brain and try to retrieve a clot and open up a vessel that was transiently occluded is a great treatment to have. I think this is really what advances in stroke care have been aiming for in the last 15 or 20 years. Initially we had TPA, which is a great therapy. We actually use it routinely. It's one of the best treatments for ischemic strokes. If we get to a patient on time within the short time window that we have after the onset of symptoms, but being able to have additional treatments for extended time windows in patients who continue to have ischemia in the brain, where we're able to get to them on time and open up the vessel and avoid significant brain damage, is actually a great thing to have. It is very challenging to explain it to families. Remember, we're dealing with acute events. Families usually extremely stressed about the acute change that happened. They're aware that this is a very severe event that can actually lead to a major lifestyle change. So, during that time, we have to sit down with them and explain to them what we do and tell them that we actually go through the groin most of the times, and we actually thread this catheter all the way up to a blood vessel in the brain and then apply one of those FDA-approved devices to retrieve the clot and take it out mechanically. Our goal is to apply the treatments as soon as possible after the onset of symptoms. So most of those devices are approved for a time window of 8 hours from the onset of symptoms. But we actually have done the treatments outside that time window. The response to stroke is really varies from a person to a person. So we see people who can actually who would not progress to having severe brain damage even in within 8 to 10 hours. So many times we apply this treatment outside of the conventional time windows because we actually are convinced that there is brain tissue to save. The classic signs of stroke are face asymmetry or slurred speech, or weakness on one side or numbness on one side, or visual changes, acute visual changes. Occasionally patients with strokes can have a headache also with those symptoms, but typically anytime there's facial asymmetry or face droop or any weakness in an arm or a leg or numbness or tingling or visual changes, we actually tell our patients to call 911 immediately.